Good evening, everyone. Welcome to the 4D show. I am Dr. Prashant Arun, consultant physician and diabetologist at MB Hospital for Diabetes. Today's topic is going to be the challenges of diabetes care. So, when I say the challenges of diabetes care, it is that either people don't know because most of them don't know that they have diabetes. Number two is that they know that they have diabetes, they don't know what test to do, where to go, which doctor to see, which medicine to see, because there are so many medicines these days to start and what all to do. And once they are a person with diabetes, next comes what all to eat. So today we have with us Dr. Sriram. He is actually the internal medicine physician. He's from District Hospital Palakkad. We have with us, sir is going to give us more about the topic and he'll let us know about all these queries. And after the topic, we'll have some discussion about some questions that we got asked. On to you, Dr. Sriram.
Thank you, Dr. Prashant. So, can I have the slides on? So, today the topic is challenges in diabetes care in India. And as the topic itself, it's really a big challenge to manage diabetes in India because of, like, in the heading itself, it's mentioned like because of the sheer numbers, lack of awareness, and inadequate control. So, next slide, please. So we all know that like India is a like 100 million nation, and we are living in with a group which has got the highest number of diabetes, almost the second highest number in the world. So actually we are facing in 1 in 11 adults who are actually diabetes in India, and in 1 in 2 adults, like almost 53.1% of diabetes are actually undiagnosed. So 40 million adults we know in India have got impaired glucose tolerance, and the complexity in managing the diabetes in India is really difficult because of the varied socioeconomic status, demography, and the environmental and genetic factors. So the other contributory factors include reduction in physical activity, increased availability of processed food, aging population, obesity, overweight, and the perception of the diabetes. The ICS study, which actually studied the to improve the control India study, which actually studied the awareness of diabetes in India. As actually Dr. Prashant rightly put in, the lack of awareness is the biggest challenge in managing the diabetes in India, because most of the people don't know whether they are diabetic. Most of them are not aware if they don't what are the symptoms of diabetes, and even if they get diagnosed, they are not sure when to start the treatment of diabetes and what all treatment they should be taking on. So first thing is the awareness regarding the problem which the population have, the awareness regarding how to go about, which system of medicine to choose, because most of the time we see a lot of patients who coming to us after getting diagnosed almost 4 to 5 years after getting diagnosed, because they were like slightly hesitant to start off a modern medicine treatment because they feel that okay, there's something wrong with this, or they need to be slightly, they can be waiting to start the treatment of diabetes. So the ICI study actually put in the doctor's prescription regarding the how the tests are monitored. So how the diabetes is monitored, and like FBS and PPBS, that's the most common test which we all do, has been done by 96 to 97% of the diabetic population. But regarding the exact control, to find out the exact control of diabetes, like to know the HbA1c of the patients, like it's really very less. Like we know, like it's only 20-25% of patients get to do HbA1c, or they really get to monitor the HbA1c. So they don't exactly monitor the exact level of their total control, but they keep on monitoring the fasting and PPBS sugar. So the lack of I would put in like one part is the lack of awareness. The other one is like there is always a tendency among the patients to get their fasting and blood PPBS sugars proper by the time they meet their physician. But other times, like within the follow-up, they tend to just lag on to this thing. They are not very keen on their diet and all. So one thing is, I would say, inadequate control. The second one, as in the first slide we have mentioned, like there is a change of aging of population, because when we were young, we all know that when we were young, India was a young country. Now actually the thing is actually changing. So now India is more of a middle-aged country. The obesity is creeping up. The lack of exercise is creeping up. Such things are actually coming up, and there is an increased urbanization which is coming up, which is actually put in a lot of packed food, junk food all into the normal diet, which was not there some 20-25 years back. So this change of demography, change of age, all has actually contributed to the uh, challenges in managing diabetes. Now, inadequate control, achieving and maintaining glycemic control is actually the most important thing in the survival as well as the overall results in managing diabetes. So the lack of general awareness of about diabetes and its complication, diagnosis and access to treatment of diabetes, especially in remote areas. Maybe not much in the southern part of India, but there's been a lot of challenges in other many other regions where there is the remote areas has don't have much access to the treatment of diabetes. Economic disparity between urban and rural settings, definitely there's been an urbanization which is going on, and that has actually added to the burden and many problems of diabetes. But the rural problems is more like lack of awareness, lack of trained healthcare professionals to manage the diabetes proper, scarcity of qualified healthcare professional. Definitely we all know that there actually the rural India is lacking in number of doctors, as well as the know-how in managing diabetes is actually lagging in many rural areas in India. The financial constraints definitely is been a problem, because I work in a government setup. I see that the financial constraints has just put in breaks to the management of, follow-up and management of diabetes in many patients who just are very hesitant to come to the hospital, even due to the cost of the medications or due to the cost of blood test and all these things. So financial constraints is definitely a problem, but that's actually improving by time. And many social barriers, including diet and all these things, has actually put in the many factors among the social barrier diabetic control. So how to manage Indian diabetes? So diet and regular exercise, like any management of diabetes, any place, the basic thing is a medical nutritional therapy, diet and regular exercise, which has been lagging most of the time, because people at times might be motivated to take medications, might be ready to start on treatment and all these things. But diet and regular exercise, it has to be really been, they have to be motivated enough to start their regular exercise at least, and to control their diet. Keeping an eye on blood sugar level, the regular follow-up is another big challenge among the Indian diabetics. People might be taking medications, might be coming back to us after 1 year telling that we've been continuing the same medications but not at all monitored at all, coming with an HbA1c of 14 or 15. Be regular with medications. At times that's also a big challenge, because people tend to just stop the medications in between, again restart it, come to a doctor, skip it in between. They think that okay, they are all okay with it because their HbA1c might be between 9 to 10. They might not have much of a symptoms. They will be just going on with the medication, skipping in between, and all these things. Control of cholesterol level, lipid monitoring, monitoring of creatinine and renal function. All these things has been, like, when the biggest challenge is even the monitoring of diabetes is not taking place. The next thing, like monitoring of lipids and creatinine, renal functions are all really challenging, especially among the rural population. Other thing is like losing of weight and all these things has been, like, everything is there in the space, everyone knows about it, but most of them actually are not putting them to the practice. So multiple factors that can be a good: glucose monitoring, medications, yoga and exercises, balanced nutrition and food, and carbohydrate counting. So Indian diet, the dietary interventions is a vital element in managing diabetes. The low glycemic index food like brown rice, wheat, oats, and all there in this thing. But the thing is, how many people have access to all these things? How many people would like to uh, put in all this diet into their normal diet is a really a challenging question, because people might like in a joint family, people might be staying, so the rice might be made as a dinner. It might be very difficult for many of the patients to have their diet made separately, or they having a separate diet. Exercise is another this thing which has been often overlooked, despite considering in relation to the drug regime. So the are not usually monitored regularly, and adherence to the medications is the biggest challenge which every diabetologist and every physician faces. Now, the treatment strategies in diabetes is definitely the early initiation of combination therapy, which has been there much earlier, because before the novel medication therapy, which all these new drugs which has come up, and which has come up as an affordable model, earlier there used to be always been a initiation of combination therapy, usually being in a government setup. I usually see like people being started on a metformin and a glimepiride. Very often that's been started as a starting regime in most of the government hospitals, and most of the people used to start all these things. But now the novel medications has actually opened up a lot of chances, lot of opportunities for the patients, because now once all these drugs have come into price control, the DPP4 inhibitors, HCL T2 inhibitors are all being prescribed regularly to the normal patients. So this has actually opened up a great opportunity for all the patients and made the thing much affordable to all the patients. So the biggest challenge being the complexity in the cultural, socioeconomic barriers, the lack of awareness. All these things are there, but I think the situation is actually improving. What I would say, that the awareness regarding the exercise, because once we just walk around, even in a small town, like I stay in a very small town in Kerala, but once I out in early morning, I see like a lot of people walking, a lot of people going for regular exercise, all these things happening regularly, so that we can always have a brighter side of the management of diabetes. And definitely the next thing I would put in is the price restriction which has come in for all the newer drugs, which has actually made the diabetic therapy much affordable. So that's what my presentation is. We can go for the
Thank you.
questions.
Thank you, Dr. Sriram Shankar. That was actually a crystal clear presentation so people can understand. Just few queries that we have from the people. One is you said about the financial constraints. So, how would your opinion be on, because there is always a saying that if you say financial problems and you don't spend on testing for diabetes, taking your medicines properly, but how are the complications going to cost? Because definitely I think the complications are going to cost more than spending for your regular medicines and testing. Can you put a small light on this, Dr. Shriram?
Yeah, that's a basic thing. That's the biggest role for a physician or diabetologist to convey to the patients, because most of them are really scared of like, okay, this is a costly medication, I won't go for that, or regular monitoring, they might be hesitant. But that's the message which all of us has to actually put across, telling that, okay, this is, once the complication sets in, the number of tablets you are taking in, the number of investigations you have to go through, and all the toil you have to go in through is much higher than what you have to do in for a 3-month monitoring. So that's definitely a thing which all of us has to put in across the patients. That's a message which all of
Yes.
us need to pass on.
Now, lately, about the SGLT2 inhibitors, because I see that there are the SGLT2 inhibitors, we say that it can avoid complications due to diabetes, like the diabetic retinopathy, nephropathy, and the complications due to diabetes. Can you throw some light on this SGLT2 inhibitors? Because many patients, they're actually afraid of taking this SGLT2 inhibitors because somebody has just told them that if you take SGLT2 inhibitor, you will develop a urinary tract infection. Can you just enlighten us about the SGLT2 inhibitors in general?
Actually, SGLT2 inhibitors are actually a wonder drug, no doubt about that. Because even before it was a costly drug, it has actually put in a lot of like to many complications of diabetes. It can definitely be a good drug to counter all these things. And the other thing is the factor regarding the urinary infection. It is only 5%. So only 5% of patients get to this. So whenever we start on an SGLT2 inhibitors, we are definitely tell them that, okay, out of 100 patients, 5 can have urinary infection. So you should be very careful regarding that. So we are all straight away telling you the complications. So don't worry about that. You need to drink a lot of water. You need to have a clean this thing and all these things which we would convey. But definitely compared to that 5% risk of urinary infection, it has got multiple advantages, and definitely we should be going for an SGLT2 inhibitor for sure.
Yes, because you're saying the risk to benefit ratio, the benefits are more compared to just the
Yeah,
5%
it's
of
much
risk.
much more. And now, since like we are all using SGLT2 inhibitors much more than, like I would say, like we would be using at least 50 times more than what we've been using 2 years back.
Yes, yes. What are
So
the
we are
other
not actually
benefits?
seeing.
Because in your presentation itself, I saw that obesity could be a reason for diabetes or uncontrolled blood sugar. So SGLT2 inhibitors even plays a vital role in losing weight, isn't it? So it's going to
Yeah,
be
definitely. Because once the SGLT2 inhibitors came in initially, like all of us were using it for the obese diabetes, and we all know that initial 6 to 9 months we used to get an excellent result regarding the weight control. Maybe people used to lose weight quite a lot, like
yes.
at least around. I would put in like 10% of weight loss. We all used to get with the patients. So definitely the weight reduction has got a definite advantage. Uh, One thing is a cosmetic advantage regarding the glycemic control, as well as multiple complications also. So definitely SGLT2 inhibitor is a wonder drug regarding the complications. And I would always put in obesity, the weight loss as the first advantage. And then only I would put all others.
Yes, because SGLT2 even gives us prevention of from these cardiac complications due to diabetes, etc. And next, you then during your talk, you were saying that you see more of people coming to you with either metformin or sulfonylureas. So there is a saying that metformin is very old and it's gone out of the market. Can you enlighten? Because metformin is supposed to be the first line drug in most of the guidelines for diabetes, and it's actually the cheapest drug available for diabetes. So, what are your views on metformin? And that you are from a government setup, I think metformin will be widely used in your government setup there also. And taking into
Yeah,
financial
definitely.
constraint that metformin is only 1 rupees or something.
Yes. Actually, metformin, none of the drug would replace metformin, what I feel.
Yes.
One thing is regarding the cost factor. Other thing is definitely once you compare metformin earlier when all these drugs came in with lesser price and all, like there was view like if you put in a gliptin, a low dose gliptin versus metformin can be compared and all these things. But definitely metformin has a specific role in management of diabetes. None of the drug would be replacing metformin. First thing is factor, the cost factor, and the next thing would be the mechanism of action, the definite glucose sensitizer which we have. So metformin has a definite role, and that would definitely be continuing. But maybe all the newer drugs might be challenging the uh, sulfonylureas and all. But metformin has a definite role.
So, what are the risk factors for people developing diabetes? Like, what should people be avoiding, or what are the risk factors for people with, like, for developing diabetes? I've seen that you've mentioned a few in your slides. Can you please enlighten on that also? What are the risk factors for people developing diabetes?
Now, like earlier in my slide, like I put in like 53% of people have impaired glucose tolerance. So definitely there is a pre-diabetes population which is waiting to get into the diabetes basket. So the biggest risk factor will be definitely a high carbohydrate diet, which all of us like in the Indian population is always fond of. Next thing would be the lack of exercise, which is a big challenge because there is increased work hours, increased study hours, all these things. So the sedentary part is actually creeping into our population. So these are the two factors which once the pre-diabetes people face in, they are definitely going to turn to the
Especially
step
you are
into the
from
diabetes
Kerala, where
basket.
we get, especially you're from Kerala, where we get delicious paisam, where we know people are
Yeah.
going to be taking paisam. And high, because Indians are more of carbohydrate friendly, because Indians take more of carbohydrate.
Yeah, definitely,
So,
because all festivals, everything, especially like from Kerala, yes, sadhya will have the bulk of it will be the carbohydrate through the rice, through payasams and multiple other things. So only the proteins come in like 5 to 10% of the sadhya. So any festival, the carbohydrates is the main dish. So
so
definitely
what would
that's
you
a
say as
part
a
of it.
diet for people with diabetes? What kind of diet can a person with diabetes take? Can you enlighten us about the diet part of diabetes?
So, in theory, we would say like you should cut down on carbohydrate, you should be taking more of protein and all these things. But in practical sense, what I would say is like whatever we try to put in across, the bulk of the population are definitely taking carbohydrate diet. So the thing is, one thing which we can put in is the idea of uh, carbohydrate counting, which we can pass on. So like some diabetic patients would prefer to take, okay, we would take two idlis instead of another dish which they won't like. So they would prefer to take a two idli instead of chapatis or this thing to balance this thing. So once they know that how much calorie they have, the calorie counting plays a very important role, and awareness regarding that will make a whole lot of difference. So what I would tell my patients is, okay, you follow your diet which you would prefer, but thing is you should know how much calorie you are taking and how much you should be continuing on that. And if you want to skip something or if you are missing on something, you just balance it with the next diet. That's what the
Yes,
message I
very
used to
good.
give.
Portion
That's
control.
a
Portion
practical
control.
sense of things which would happen.
Yes, portion control plays a very vital role in the this thing. Next is another few questions that we always get asked is about insulin. So people with diabetes, when do we start them on insulin? That is number one. Number two, many people have this query. Once if they are started on insulin, whether they'll have to continue it lifelong, or can they be switched back to tablets? With we talking that now we have the SGLT2 inhibitors and the DPP4 inhibitors. Maybe once started on insulin, when can we switch them back to tablets, and whether these insulins actually have any side effects? Because many people are even scared of starting insulin, saying once I start insulin, I'll develop kidney problem and that and this. Can you throw some light on this, please?
The stigma and the rumors regarding insulin is much higher, because people would prefer to take at least some 8 mg glimepiride, would take the full dose of all the tablets and still wait to start insulin, because they are really scared regarding one thing. They feel that the injection, the issue with the injection, they don't know how to do it, they don't have people to help them out. That's the biggest challenge the elderly population is facing. The next thing is they don't know, like they are really scared, like you had rightly pointed out, like once you start on insulin, we are not nobody will shift you back to the normal drugs. That's what they are scared of. So the message what we all would be conveying is like, okay, insulin is a wonder drug. That's something which everyone, all of us will have in our body, and we are just supplementing it to the as a part of the treatment. And the interesting thing is, somebody once started on insulin, even if we tell them to shift them back, they will be hesitant, because the advantages of insulin are so much, the total, even everything, like regarding the flexibility, easy administrability, everything. Once they are onto that track, people will be very quite hesitant to shift back to the OHS. So that's what we used to convey, like it's very difficult to start it, to put the message across, but once they start, and it's definitely people are, I personally have seen many people very hesitant to come back to the OHS, because now they take very less number of tablets. It's only one prick, so everything is much better now. And even like they will have slight weight gain, their cosmetic appearance improves, a lot of things. There are lot of advantages for insulin. So once on to insulin, it's much easy.
Yes, but definitely we can pull down the patient off insulin also. Once that glucotoxic phase is over, we can definitely switch back the patient to
Yeah,
OHS also
definitely,
in case
definitely.
they
We
need.
can definitely bring them back to the OHS or bring them back once they follow the initial part, like diet, exercises, everything are put in proper. We can definitely bring them back.
So next is when we say insulin, because people are even scared of pricking. But then once about insulin, next when we tell them please go home, check your blood sugar, they're still scared because again it's going to be pricking. So then now we have this latest technologies like the continuous glucose monitoring system for people who are actually afraid to prick. So can you, what is your opinion about the continuous glucose monitoring system?
No, continuous glucose monitoring system will bring into light the all the changes what a patient would do, because like earlier I actually pointed out, like many people, like if somebody is on a 2 months review, they might be missing on many things in between. They might be missing tablets, they might be having sweets in between, they might be skipping exercise. All these things might be happening, and once they are back to us, they will be bringing a good FBS and PPBS. HbA1c to a certain extent can bring in light to this, but the factors influencing HbA1c are too much that, like at times we might not be able to trust it, because there might be a iron deficiency or multiple other factors which might be influencing that. CGMS, once if done properly, and other factor I would put in, once if made affordable to everyone, will be a
Yes.
wonder thing, because CGMS can definitely bring into light the exact control, which diet they need to restrict, which part they need to increase the insulin, and all these things can be definitely put in across with proper evidence. So CGMS is definitely a wonder thing once made affordable. Now CGMS is not affordable to the most of the population, but once there, it will definitely be a game changer.
What are the tests that you will recommend for people with diabetes to do? That is when they come to your OPD to meet you. And how often would you tell them to come back and repeat those tests?
So for a newly diagnosed diabetes, definitely I will go for all the tests, like a fasting PPBS, to actually enlighten them regarding their previous diabetes control. Definitely HbA1c, a renal function test, a urine ACR, and a lipid profile for sure, and a thyroid function test to as an add-on. So this will be my first prescription for any patient who come to an OP. On a review basis, even like regarding considering the affordability and all other things, my prescription might change. The demand of tests might change, but usually it will be an FBS, PPBS, and HbA1c, and a renal function monitoring at least 6 months, and a lipid function, lipid profile, and all the others, hemoglobin and all, will be measured on a yearly basis.
What are the tests to do the complications due to diabetes? Because patients come only for the blood test, or should they even test their eye, heart? Because they say, I've come here only for testing my diabetes. But it is so important that we test their diabetes and help them prevent their complications. So, what are the tests they can do, like for the eye, kidney, heart, and their leg? Because most of the patients with diabetes tend to develop diabetes foot infection very commonly. So, what are the tests that you can do to prevent them or even let them know whether they've already developed the diabetic complications? So, tests for diabetes, you have told now. What about the tests for the complications? What are the things that they can look in for? And what, just can you enlighten us about the complications due to diabetes?
So all those microvascular complication screening should be definitely be there for all the diabetics. I would say, like a yearly retinopathy screening should be there, the neuropathy screening should be definitely be there, and ACR monitoring, a urine ACR should be done at least on a 6 months period, to monitor the basic. These are the complications which are mostly missed in a regular practice, because people might not be really considering about an albuminuria, or they might not be like too much careful about the neuropathy and all. So these are things much often missed at times, and the thing is to put in them through all these things and to motivate them to all these things is the biggest challenge. But definitely this need to be monitored, because this is what we are actually targeting by managing a diabetes, to prevent the complications, especially the microvascular complications. The other things like an ECG, definitely we will be doing that in between, and all these things should, and the lipid profile and all, should be part of the diabetes monitoring for sure.
Yes. So maybe we'll just move on to the last question. Diabetes reversal, because now if you open Facebook, Instagram, YouTube, everywhere we see flooded with things saying reversal of diabetes, reverse your diabetes, pay 100 rupees to reverse your diabetes. What is your say on reversal of diabetes? Is there anything called reversal of diabetes? Or it's just that your diabetes is under control? Can you please put in some light on that?
For a newly diagnosed diabetes, I would say that, okay, somebody coming with a 250 or a 250, 280 or random blood sugar and an HbA1c maybe 7 to 8, I would tell them, okay, this is possible if you put in like the first two steps of diabetes. One is a proper exercise and a proper diet. If you can do, this is possible for you. But somebody with a 10-year diabetic with one or two complications, it is practically impossible, which all we all know. But an initial newly diagnosed diabetes, the reversal is possible if he or she stick on to the basics like diet and a proper exercise. So in that regard, the reversal is possible, but not for people who are already a long-term diabetic with complications on. It's practically impossible. But the idea is, like many other disease, diabetes is also something which we will be keeping in control. So that's sort of a reversal. Like once a good glycemic control, avoiding complications and all, it's equivalent to a reversal, and you will live with diabetes but without much complications. That would be the message which I would.
Yes. So thank you, Dr. Shriram. That was such wonderful experience talking to you, and we had so many of the doubts cleared, and it was all crystal clear explanation. So thank you everyone for watching, and thank you, Dr. Shriram.